Welcome, my name is Sebastian Nengers and next to me is Enora. And together we have developed the guidance on transition for the ESPE and ESE. So Enora, I hope you enjoyed the project as much as I did. So if you look back at some of the highlights which we went through, so what is your, let's say, main take-home message from the guidance document?
I think the take-home message is to say to each services that everybody can do things for transition. We find some things in the literature saying that there is some key points that have to be done everywhere. A lot of question, I think, around transition is a question of feasibility. And what we saw in our guidelines is that a lot of things are doable just with the resources that everybody have in his own services.
Yeah, so in essence, it means that although if you have a little bit more resources, it probably will be beneficial, but in general, with not too much additional resources, you can actually improve it quite significantly.
Yeah, that's true.
Yeah.
It's exactly the thing, I think, for transition coordinator, who can be anybody in the service.
Yeah. Yeah, so yeah, you're right, I think, because what I also learned from going through all these documents and manuscripts is that the care coordination and the care coordinator is very important, but also there's no specific time when somebody needs to go into transition. And in some countries, it will depend on the local, let's say, reimbursement or legislation. So it's a broad range up to adolescents actually, or it can be even a little bit on the early adolescence moment. But there's a broad range of ages where you can go into transition.
That's true, and there is tools, readiness tools that can help you to know exactly the stage of preparation of adolescent and who can help you to decide when is the time with the adolescent and with his family to go to adult care.
Yeah, because I think apart from what I was saying, it's not just what legislation and reimbursement says, it's of course when the patient is ready.
Yeah.
And the doctor maybe as well.
Absolutely.
So were you a little bit surprised by the fact that we do have quite a lot of gaps of knowledge?
Yeah, absolutely. There is only few RCT actually on transition to adult care. I think there is a lot ongoing. So in few years, probably we will have to read again this recommendation that we are doing in the light of the results of this RCT. But we are talking a lot on this subject with no big proof.
So where would you put your money as a next project to really engage in and look for additional evidence?
Well, I think there is two things. I think that a lot of services already began things for transition, so maybe we can just evaluate what is done in each hospital. There is a lot of initiative. Also, I think that we have to try to study maybe the implementation of this recommendation. Everybody says it's difficult to implement, but why? And how we can enhance things. Maybe it's a good idea too.
So it's not just assessing the barriers within transition, but also the barriers for transition as a hospital. Yeah, that makes sense. So, well, I think what we've seen here, it's been a great congress and it's had a huge impact. And I hope that our transition guidance will also help the average endocrinologist and pediatric endocrinologist to improve it. But I don't want to speak for you, but I think what we probably would like to do is, apart from handing over this guideline in the future, but also develop additional education packages.
Yeah, that's true.
Yeah.
I think that a lot of people do not feel sufficiently ready to speak about transition, to speak with adolescents and young adults. And of course, education to this professional have to be done.
Yeah. So I think we can end with saying that probably you will hear more from us and we'll provide you some additional education or courses which is coming out of this combined guidance document of ESPE and ESE.
Absolutely.
Thank you.
Thanks.